this yours? Yes. Got it? Yep. Wow, thank you so much. That was amazing. Such a good talk. I'm sure some of you are going to have more questions for him. I think he's planning on staying here for a few more days, right? So they can ask questions to him over the next few days. All right, so moving on to our final lecture for this morning. It's going to be brought to us by our GOGS Post-Road Task Force. Dr. Melissa Kottke, better known as Missy to all of us who know her, is professor in the Department of Gynecology and Obstetrics at Emory University School of Medicine and professor in the Department of Behavioral, Social, and Health Education Sciences at the Rollins School of Public Health, also at Emory University. She serves as director of the Jane Fonda Center and medical director of the Grady Teen Services Clinic. She graduated from the University of Minnesota. She completed her residency in OBGYN at the University of Texas Southwestern in Dallas, and that was followed by fellowship in complex family planning at Emory, where I was fortunate enough to train under her. Dr. Kottke went on to complete an MPH and an MBA, both from Emory. Her current areas of research include over-the-counter contraception and ways to improve sexual health for teens. Dr. Kottke has received a number of awards, including the Emory 1% Award in recognition of a federal grant that scored in the first percentile of all applications received. She also has won the Chairman's Award, which recognizes distinguished faculty in gynecology and obstetrics at Emory University School of Medicine, and the Unsung Heroine Award, identifying her as one of Emory University's Women of Excellence. Our second speaker, who's going to be joining Dr. Kottke up here as well, Dr. Nisha Verma, is adjunct assistant professor in the Department of Gynecology and OBGYN and OB at Emory University. She received her bachelor's in biology and anthropology and her medical degree from the University of North Carolina. She graduated from OBGYN residency at Beth Israel and completed her fellowship in complex family planning and master's in public health from Emory. There's a common theme here, lots of Emory time, right? Dr. Verma has expertise in conducting qualitative abortion-related research in restrictive areas and working at the intersection of policy, advocacy, and research. She's particularly interested in leading research that's focused on exploring the impacts of the changing legal landscape around abortion on people in the U.S. Southeast. Her vision is to produce data that can be used to push for policy change and improve access to abortion in the U.S. Southeast. So I would like to welcome both Dr. Kottke and Dr. Verma to the stage at this point. I'm sorry your time has been cut off somewhat, but I think we'll be able to get through your entire talk. And I want to also say, Dr. Kottke wanted me to remind everyone, we have a GAP QC table, and she's going to show off that stuff here. Right outside in the main hallway, it has a lot of really helpful information about maternal cardiac initiatives and handouts for doctors as well as for your patients. In addition, there is a table that Emory has with a few research surveys, which I will let you describe a little bit more detail.
Sure.
Okay, cool.
Thank you. Give us a high five when we need to stop.
I think you can start your timer.
Okay.
And then you'll see the colors. Oh, okay. I will give you a
Okay. Thank you all so much. Yeah, look I have all of these handouts from GAP QC. You too can have these. They're right outside the door. Would like to acknowledge Dr. Teresa Bird, Dr. Jane Ellis, Lisa Ely, and Amy Satin from DPH. There are remarkable things that are happening with GAP QC and the Cardiac Initiative, and so go shopping. Then the Emory survey is at booth 25. All are invited. There's a QR code to fill it out, and if you do, it's $50. There's also a focus group discussion if you're so interested. But I digress. Our topic this morning is called 1 year post-Dobbs. Where are we now? It's a good question. Would like to acknowledge our disclosures. I received some consultant funding from HRA Pharma and grant funding from Organon. Dr. Verma, after her year of working as the Darney Landy Fellow at ACOG, continues to be a consultant for ACOG. Other kind of just big picture disclosures, we're not lawyers. Please don't take anything that's in this presentation as legal advice. If you have legal questions, please reach out to your own personal counsel, your institutional lawyers, Abortion Defense Network, if, when, how. Ask Slade, he might have some ideas for you about your legal questions. The final disclosure is that we are going to be talking about abortion and abortion policy, and just want to acknowledge that this is complicated. People have a lot of complicated feelings, personally, experiences, and that's true of each one of us as a clinician, of our patients, of our families. And we acknowledge that, and that's part of the reason it's so important we talk about it. Our objectives today is to describe the dynamic landscape of reproductive health policy, its impacts across the nation and here in Georgia, identify resources to support y'all and your patients in this changing time, and consider opportunities for advocacy as physicians. It's really hard to think back about the year that we've had, particularly when it comes to abortion policy. To level set, I'm pretty sure most of y'all remember that on June 24th of 2022, the Supreme Court shared its ruling on Dobbs v. Jackson, which functionally undid the holding and overturned Roe v. Wade, which had been in place for approximately 50 years. The majority decision said, and I think that this is really important as we think back about the year that we've had and the years that we're going to have, is that the Constitution does not confer a right to abortion, and the authority to regulate abortion is returned to the people and their elected representatives. Here we have Judge Alito, who wrote the opinion, oopsie, and then that picture there was a little snapshot of US states that had trigger laws that we had anticipated might have changes to policy after Dobbs was decided. So, thinking about this slide, I spent a lot of time thinking about the title of this slide, and I was like, what word should I use? So I landed on dynamic, changing. There's been a lot going on. And I would say that most days, abortion has been in the news. It's been in the news, like all over the news feed, all over newspapers, print, social media, it's been on television, it's been literally everywhere. And it's been incredibly complex. And it's that complexity that we do want to talk about a little bit today. Over this past year, we've had to kind of think through, and each state is doing so in its own way, in its own timetable, in its own space, potentially 100 years old plus laws that are now law. State constitutional questions. Different states have held like immediate and unplanned special sessions to pass laws. Different states have had ballot initiatives bringing the issue of abortion actually to the people. It has been a very interesting time. And people have been busy. This is from the New York Times. There are several different spaces that have been trying to track what's been happening state by state. New York Times is one, Center for Reproductive Rights, Guttmacher. They all kind of tell the same story. Importantly, I want to highlight that this was updated August 23rd. But what you see here is these are states that have full abortion bans or have early gestational age bans. There are 22 states in total. What's interesting is that doesn't tell the whole story, is that we also have states that had laws passed that then went to their state